Assalamu alaikum. Abnormal rate or rhythm is an arrhythmia. They are of two main types: bradyarrhythmias, tachyarrhythmias. Tachyarrhythmias include atrial flutter, atrial fibrillation, ventricular tachycardia, ventricular fibrillation. Bradyarrhythmias include sixth sinus syndrome and atrioventricular block. The ECG of all tachyarrhythmias have been mentioned in the last lecture. In AV block, P wave is not followed by QRS complex in the regular manner. This may appear as a drop beat on clinical examination. The AV block is of three types. In AV block type 1, PR interval remains constant but is prolonged. Type 2 AV block is of two types. In Mobitz type 1, there is progressive lengthening of PR interval until the beat is dropped. In Mobitz type 2, P waves are conducted to QRS in the ratio of 3:1, 4:1. In type 3, the P and QRS complex are totally unsynchronized. As one can imagine, all bradyarrhythmias have a heart rate of less than 60, and all tachyarrhythmias have a heart rate of more than 100. Atrial fibrillation is the most commonly occurring arrhythmia around the world. In all tachyarrhythmias, if the patient is clinically unstable, electric cardioversion is done. Otherwise, chemical cardioversion is carried out by medicines like adenosine and digoxin, which are given in SVT. Catheter ablation plays an important role in the management of supraventricular tachycardia too. Mace procedure is done if the patient does not respond to conventional methods of treatment. In atrial fibrillation, atropine and epinephrine and amiodarone are given in ventricular arrhythmias. The treatment of bradyarrhythmias depends on the clinical condition of the patient, but type 3 AV block usually require a pacemaker. Holter monitoring, event recorder, tilt table testing, cardiac magnetic resonance imaging, and electrophysiological studies are all different diagnostic tools to detect arrhythmias. Contrary to popular beliefs, beta blockers are still playing a vital role in rate management according to the most latest guidelines that came in 2022. Besides that, catheter ablation comes strongly advocated, and for the first time, there are algorithms for evaluation and follow up of patients requiring sodium channel blocking agents and QT prolonging drugs. Allah Hafiz, and don't forget to subscribe, like, and share my channel.